Have you been living with uncomfortable bloating, burning in your chest, a sour taste in your mouth, or sharp stomach pain? You're not alone. These symptoms are more than just annoying. They could be signs of deeper digestive issues like acid reflux, gastritis, heartburn, or even a peptic ulcer. And while most people turn to pills, antacids, or acid blockers for quick relief, the truth is those drugs often cover the symptoms but ignore the root cause. In this video, you'll learn what these conditions really are, what causes them, how they're connected, and most importantly, how you can start healing naturally from the inside out. Let's begin. What is heartburn? Heartburn is that burning sensation in your chest, especially after meals or when lying down. It happens when stomach acid backs up into the esophagus, irritating the lining. Despite the name, heartburn has nothing to do with the heart. But because the sensation is felt near the chest, many people confuse the two. What is acid reflux? Acid reflux is the root mechanism behind heartburn. It occurs when the lower esophageal sphincter, a muscular ring between the stomach and esophagus, relaxes when it shouldn't. This allows stomach contents to rise up, causing irritation. GERD, or gastroesophageal reflux disease, is when acid reflux becomes chronic and leads to inflammation, scarring, and long-term complications. What is gastritis? Gastritis refers to inflammation of the stomach lining. This can be acute or chronic, and it can be caused by infection, poor diet, stress, alcohol, or medications like NSAIDs. Symptoms include upper abdominal pain, nausea, loss of appetite, bloating, and sometimes vomiting or black stools in severe cases. What is a peptic ulcer? A peptic ulcer is an open sore in the lining of the stomach or small intestine. Most ulcers are caused by a bacterial infection called Helicobacter pylori, or by long-term use of NSAIDs like ibuprofen. Symptoms include burning stomach pain, pain that worsens when the stomach is empty, nausea or bloating, and dark or bloody stools in severe cases. Let's look at the major causes, triggers, and risk factors. Poor diet. This includes highly processed foods, fried or spicy meals, acidic foods like citrus and tomato, and excessive caffeine or alcohol. Low stomach acid. One of the biggest myths is that heartburn is caused by too much stomach acid. In many cases, it's actually too little, which slows digestion, causing food to ferment and push acid up into the esophagus. H. pylori infection. This spiral-shaped bacteria burrows into the stomach lining, weakening its defenses and leading to ulcers and gastritis. Chronic stress. Stress increases acid production, slows digestion, and reduces mucosal protection in the stomach, making it more vulnerable. Medications. NSAIDs, antibiotics, steroids, and long-term use of proton pump inhibitors can all increase your risk. Smoking and alcohol. Both weaken the esophageal sphincter and increase acid secretion while damaging the stomach lining. Obesity and overeating. Increased abdominal pressure from excess fat or large meals can cause acid to reflux back into the esophagus. Before we talk about remedies, let's understand the natural healing principles. The goal is to soothe inflammation, repair the gut lining, balance stomach acid levels, and remove irritants and root causes. This isn't about masking symptoms. It's about rebuilding your gut's natural defenses so you don't need pills in the first place. Here are natural remedies that can help. Aloe vera juice. It soothes and cools inflamed esophageal and stomach lining. It helps reduce acid reflux and heal gastritis. Take 1/4 to 1/2 cup of pure aloe vera juice on an empty stomach daily. Betaine HCl with pepsin. For those with low stomach acid, this supplement supports digestion and prevents reflux caused by fermentation. Always take it with protein-rich meals. Avoid during active ulcers unless supervised. Slippery elm and marshmallow root. Both create a protective gel-like layer over irritated tissue. They are excellent for heartburn, GERD, and gastritis. Drink as tea or take in powdered form before meals. Manuka honey. It's naturally antibacterial and especially effective against H. pylori. It helps coat the stomach and esophagus. Take 1 teaspoon on an empty stomach 2 to 3 times a day. Deglycyrrhizated licorice, or DGL. It promotes mucus production to protect the stomach lining. Chewable tablets taken 20 minutes before meals are best for gastritis and ulcers. Apple cider vinegar. For those with low stomach acid, dilute 1 tablespoon in water before meals to support digestion and reduce reflux. Avoid this if you have an active ulcer. Stress reduction. Chronic stress impairs digestion. Use breathwork, yoga, meditation, walking, or journaling to activate the parasympathetic nervous system, your rest and digest state. Bone broth and L-glutamine. These are rich in collagen and amino acids that repair the gut lining. They're great for all conditions, especially gastritis and leaky gut. Drink warm broth daily or take L-glutamine powder on an empty stomach. Eat smaller, slower meals. Large meals put pressure on the stomach and the esophageal sphincter. Chew thoroughly, avoid eating late, and stop eating when you're 80% full. Elevate your head during sleep. Prevent nighttime reflux by sleeping with your upper body slightly elevated. Also avoid eating 2 to 3 hours before bed. Now here's what to avoid. Fried and spicy foods. Caffeine and soda. Alcohol. Processed sugars. Dairy for some people. Smoking. Eating right before lying down. And overusing NSAIDs or acid-blocking medications. You don't have to suffer in silence or depend on pills forever. With the right natural tools, dietary changes, and a deeper understanding of your body, you can reverse heartburn, ulcers, acid reflux, and gastritis naturally. Start slowly. Choose a few of the remedies we've discussed today. Support your body. Give it what it needs to heal. And always remember, your body isn't broken, it just needs the right conditions to thrive. If you found this video helpful, give it a like, share it with someone who needs this information, and subscribe.